Ever wondered what exactly happens during a seizure, or why they occur in the first place? Well, today we're going to delve into this fascinating yet complex topic. A seizure is essentially a sudden, uncontrolled electrical disturbance in the brain. It can cause changes in behavior, movements, feelings, and even consciousness levels. If you've ever seen someone experiencing a seizure, you'd know that it can be quite alarming. So, what exactly triggers these electrical disturbances? The causes are many and varied. For some, it could be due to genetic influence, while others might have experienced head trauma, stroke, or brain tumor. Certain diseases like meningitis or autoimmune disorders can also be culprits. Even something as common as high fever in childhood can cause seizures, but it's important to note that seizures aren't always linked to an underlying disease. In fact, for about half of the people who experience seizures, the cause remains unknown. Now, on to the symptoms. These can differ greatly, as seizures can affect any process your brain coordinates. You might notice unusual sensations, emotions, and behavior. Some people may experience staring spells, while others may have violent shaking and loss of consciousness. The type of seizure a person experiences depends on how and where the electrical activity in the brain occurs. Partial seizures, which occur in just one part of the brain, may cause twitching or changes in sensation, such as taste or smell. Generalized seizures, on the other hand, affect all areas of the brain and can cause loss of consciousness, falls, or massive muscle spasms. So, how do we treat seizures? Well, the primary treatment method is anti-seizure medications. These drugs reduce the frequency and severity of seizures, helping many people become seizure-free. In some cases, when medications aren't effective, surgery may be an option. This involves removing the area of the brain where the seizures originate. Another treatment approach is vagus nerve stimulation, where a device is implanted under the skin to stimulate the vagus nerve with electrical impulses. This can help control seizures. To sum up, seizures are sudden, uncontrolled disturbances in the brain, which can cause changes in behavior, movements, feelings, and consciousness. Their causes are varied, and their symptoms depend on where in the brain the disturbance occurs. Treatment primarily involves medication, but surgery and nerve stimulation can also be used in certain cases. Understanding seizures can help us better empathize with those who experience them and further our knowledge of this complex brain phenomenon. It's a vast topic with much more to explore, but this should give you a solid foundation to build on. Remember, knowledge is power, especially when it comes to our health.